Diarrhea is more than just an uncomfortable inconvenience. It is a significant health issue that affects millions globally every year. It refers to the condition of having loose, watery stools that occur more frequently than one's normal bowel movement. This condition can strike anyone, anywhere, regardless of age, gender, or socioeconomic status. Understanding this common yet troublesome condition is crucial because it can lead to severe dehydration and other health complications if not addressed properly. Dehydration occurs when the body loses more fluids than it takes in, which can be particularly dangerous for young children and the elderly. The World Health Organization identifies diarrhea as a leading cause of malnutrition and mortality among children in developing countries, making it a critical public health matter. In these regions, limited access to clean water and proper sanitation exacerbates the problem, leading to frequent outbreaks. The causes of diarrhea are varied, ranging from infections and food intolerance to more serious digestive disorders. Bacterial, viral, and parasitic infections are common culprits, often stemming from contaminated food or water. Regardless of the cause, the effects on the body can be debilitating. The loss of fluids and essential nutrients can lead to weakness, fatigue, and a general sense of malaise. Diarrhea often sweeps out not only the unwanted substances and pathogens but also essential nutrients and electrolytes. This can disrupt normal bodily functions and weaken the immune system, making the body more susceptible to further infections and complications. Moreover, the social and economic impact of frequent or chronic diarrhea can be profound. It often leads to missed work or school days, and in places without adequate healthcare services, it can cause prolonged illness and even death. The financial burden on families can be significant, especially in low-income areas where medical expenses can be a heavy strain. The cost of treatment, combined with lost income due to missed work, can push families further into poverty. By understanding the various aspects and impacts of diarrhea, individuals can better manage their health and mitigate the broader socioeconomic consequences. Preventive measures such as proper hand washing, safe food preparation, and access to clean water are essential in reducing the incidence of diarrhea. In this light, educating oneself about the causes, symptoms, and remedies for diarrhea is not just a matter of personal health, but also of public importance. Community health initiatives and public awareness campaigns play a crucial role in disseminating this knowledge. This knowledge empowers individuals to take swift actions, whether it's seeking medical attention or implementing preventive measures, thereby reducing the overall burden of this ailment on society. Simple steps like staying hydrated, using oral rehydration solutions, and seeking timely medical care can make a significant difference. In conclusion, while diarrhea is a common condition, its impact on health and society is far-reaching. By staying informed and proactive, we can all contribute to reducing its prevalence and severity. This collective effort not only improves individual health outcomes, but also strengthens community resilience against this pervasive health issue. Diarrhea can stem from numerous factors, and identifying the cause is the first step towards effective management. Infectious agents such as bacteria, viruses, and parasites are among the most common causes. For instance, bacteria like Escherichia coli or E. coli, and viruses such as norovirus lead to foodborne illnesses resulting in diarrhea. These pathogens commonly enter the human body through contaminated food or water, emphasizing the importance of hygiene and safe food practices. Another significant cause is dietary factors. Lactose intolerance, for example, can cause diarrhea when dairy products are consumed by individuals who lack the enzyme necessary to digest lactose. Similarly, artificial sweeteners and certain types of carbohydrates that are not easily absorbed by the body can lead to osmotic diarrhea, where excess water is drawn into the bowels. Medications can also induce diarrhea. Antibiotics, while useful for killing harmful bacteria, often disrupt the natural balance of bacteria in the gut, leading to diarrhea. Furthermore, medications such as antacids that contain magnesium and cancer therapies can have similar effects. Understanding these associations helps in managing the condition more effectively, especially under medical guidance. In addition to these, there are also chronic conditions like Crohn's disease, ulcerative colitis, and celiac disease that cause frequent episodes of diarrhea. These conditions require medical diagnosis and long-term management strategies. Thus, the causes of diarrhea are multifaceted, and addressing them requires a comprehensive understanding of both lifestyle factors and underlying health conditions. Diarrhea is not a one-size-fits-all condition. It varies in duration and severity, affecting individuals differently based on various factors such as age, underlying health conditions, and environmental influences. It is broadly categorized into three types: acute, persistent, and chronic, each with its own set of causes, symptoms, and implications for health. Acute diarrhea is the most common form, usually lasting a few days and often caused by a bacterial or viral infection. This type of diarrhea can be particularly disruptive, leading to missed school days for children and work days for adults. Persistent diarrhea lasts for 2 to 4 weeks, often resulting from prolonged infections or underlying health issues that require more extensive medical evaluation and treatment. Chronic diarrhea extends beyond 4 weeks and is typically associated with digestive disorders like irritable bowel syndrome or inflammatory bowel disease. This prolonged condition can significantly impact a person's quality of life, leading to ongoing discomfort and the need for long-term management strategies. The impact of diarrhea also varies across different age groups, with each demographic facing unique challenges and risks. In young children, particularly in developing countries, acute diarrhea can quickly lead to dehydration due to their smaller body size and higher metabolic rate. This rapid onset of dehydration can be life-threatening if not addressed promptly. This makes prompt and effective treatment essential to prevent severe complications like malnutrition and impaired cognitive development. Ensuring access to clean water, proper sanitation, and timely medical care are critical steps in managing acute diarrhea in children. For elderly individuals, chronic diarrhea can exacerbate pre-existing conditions such as diabetes or cardiovascular diseases. Their generally weaker immune systems make recovery slower and more difficult, often requiring a comprehensive approach to care that addresses both the diarrhea and the underlying health issues. Pregnant women are another group that requires special attention when it comes to diarrhea. The physiological changes during pregnancy can make women more susceptible to infections that cause diarrhea. Hormonal changes during pregnancy can increase susceptibility to infections that cause diarrhea. This heightened vulnerability necessitates careful monitoring and management to ensure both maternal and fetal health. Additionally, the condition can interfere with the absorption of nutrients that are crucial for fetal development, highlighting the need for cautious management during pregnancy. Proper hydration and nutritional support are essential to mitigate the risks associated with diarrhea in pregnant women. Understanding these distinctions is vital for tailoring prevention and treatment strategies according to the specific needs of each demographic. This includes developing age-appropriate interventions and ensuring that healthcare providers are equipped to address the unique challenges faced by each group. It also underscores the need for targeted health education and interventions that can effectively address the unique vulnerabilities of each group. Public health campaigns and educational programs can play a crucial role in raising awareness and promoting best practices for preventing and managing diarrhea. The varying types of diarrhea and their differential impacts across age groups illustrate the complexity of this condition. Each type requires a tailored approach to treatment and prevention, taking into account the specific needs and vulnerabilities of the affected individuals. It is not merely a transient issue, but a significant health challenge that necessitates a nuanced understanding and approach, particularly in vulnerable populations. By recognizing the diverse impacts of diarrhea and implementing targeted strategies, we can improve health outcomes and quality of life for those most at risk. Recognizing the symptoms of diarrhea is crucial for timely and appropriate management. Early identification can significantly improve the outcome and prevent complications. The primary symptom is the frequent passage of loose, watery stools. This can occur several times a day and is often accompanied by a sense of urgency. However, associated symptoms can include abdominal cramps, bloating, and an urgent need to have a bowel movement. These symptoms can vary in intensity and may be accompanied by a feeling of general discomfort. In cases where diarrhea is caused by an infection, fever, chills, and bloody stools may also be present. These additional symptoms can indicate a more serious underlying issue that requires prompt medical attention. Noting the presence and combination of these symptoms can help in determining the underlying cause and the severity of the condition. This is essential for tailoring the appropriate treatment plan. Diagnosis of diarrhea generally begins with a medical history and a physical examination. The healthcare provider will ask detailed questions to understand the onset, duration, and nature of the symptoms. Healthcare providers may ask about recent travel, food consumption, and medication use to identify potential causes. Travel history is particularly important as it can point to infections acquired abroad. In more severe or persistent cases, stool samples might be analyzed to detect the presence of pathogens, parasites, or blood. This helps in identifying specific infections that may require targeted treatment. Blood tests can also be conducted to check for signs of dehydration or electrolyte imbalances. Dehydration is a common complication of diarrhea and can be life-threatening if not addressed promptly. For chronic cases, further diagnostic tests like colonoscopy or imaging studies may be necessary to explore underlying conditions such as inflammatory bowel disease or intestinal abnormalities. These tests provide a more comprehensive view of the gastrointestinal tract. A thorough diagnostic process not only aids in effective treatment, but also helps in preventing recurrence by addressing the root cause. Understanding the underlying issue is key to long-term management and prevention. Moreover, self-monitoring of symptoms can be an effective tool for individuals to gauge the severity of their condition. Keeping a symptom diary can help in identifying patterns and triggers. This is particularly important in managing mild cases at home, where over-the-counter medications and home remedies can be employed before seeking medical help. Simple measures like staying hydrated and eating a bland diet can make a significant difference. Knowing when to seek medical attention is crucial. For instance, if symptoms persist beyond a couple of days or if there are signs of severe dehydration such as dizziness or decreased urine output, medical intervention becomes necessary. Early medical intervention can prevent complications and ensure a quicker recovery. Understanding the symptoms and the diagnostic process not only empowers individuals to take appropriate action, but also facilitates better communication with healthcare providers, ensuring that the management and treatment of diarrhea are as effective as possible. Effective communication can lead to a more accurate diagnosis and a more personalized treatment plan, ultimately improving patient outcomes.